Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 18 Practice NCLEX questions. Without delay, let's get started.
Which action by the nurse is likely to increase the anxiety and suspiciousness of a client who is delusional? 1. Informing the client of schedule changes. 2. Whispering with others where the client can observe. 3. Telling the client gently that the nurse does not share the client's view. 4. Inviting the client to join in leisure activities. The correct answer is 2. Whispering and laughing with another person where the client can see or observe a nurse, but not hear the conversation, increases the client's anxiety and suspiciousness. Therefore, this action should be avoided. Informing the client of schedule changes. Telling the client gently that the nurse does not share the client's interpretation of an event, and inviting the client to participate in leisure activities help the client to decrease anxiety and suspiciousness and to focus on actual or realistic events. The plan of care for an outpatient client with chronic undifferentiated schizophrenia includes risperidone therapy. The nurse prepares to administer this drug based on the understanding of which of the following? 1. The positive symptoms of CUS are usually more prominent than the negative symptoms. 2. Agranulocytosis is less of a risk with risperidone therapy than with clozapine. 3. Traditional antipsychotics help with negative symptoms, but not as well as Risperdal does. 4. Risperidone is less expensive than traditional antipsychotics. The correct answer is 2. With CUS, negative symptoms are more prominent. Therefore, risperidone is given to help control negative symptoms. Negative symptoms do not respond to traditional antipsychotics, such as Haldol or Thorazine. Agranulocytosis is commonly associated with clozapine. Because it is a newer drug, risperidone usually is more expensive than traditional antipsychotics. A newly admitted client with an acute exacerbation of psychotic symptoms of chronic undifferentiated schizophrenia is having trouble deciding whether to live in a group home or a supervised apartment. When caring for this client, which of the following activities is most appropriate for the nurse to ask the client to do initially? 1. List the pros and cons of each housing option. 2. Choose between apple and orange juice for breakfast. 3. Identify why the client cannot live in an unsupervised apartment. 4. Decide which staff member the client would like to have today. The correct answer is 2. The client is in an acute psychotic state and cannot process complex decisions or explain complex situations. Therefore, the nurse would focus on decision making involving simple choices, listing the pros and cons of each housing option, and identifying why the client cannot live in an unsupervised apartment involve complex decision-making skills. Deciding which staff member to have today is a difficult and threatening decision for a client who is psychotic. A client with chronic undifferentiated schizophrenia reports doing very little all day except sleeping and eating. The nurse should 1. Have 3 meals per day brought in to increase the amount of time the client spends out of bed. 2. Ask a relative to call the client at least 10 times a day to decrease the sleeping. 3. Help the client set up a daily activity schedule to include setting a wake-up alarm. 4. Arrange for the client to move to a group home with structured activities. The correct answer is 3. The client with CUS needs more structure every day to improve functioning. Therefore, helping the client to set up a daily activity schedule is most appropriate. However, a group home is not necessary. The client is already eating. Having meals brought in would increase the client's dependence, not his activity level. Asking a relative to call the client 10 times per day is unrealistic given the typical daily responsibilities of a healthy relative. What is the most appropriate long-term goal for an outpatient client with chronic undifferentiated schizophrenia who has been withdrawn from friends and family for 3 weeks? 1. Calling the client's mother once a day. 2. Attending day therapy 3 times a week. 3. Allowing 2 friends a visit every day. 4. Remaining out of bed for 10 hours a day. The correct answer is 2. Attending day therapy 3 times per week is a long-term goal that will show the most progress in overcoming withdrawal. The client's calling his mother is a first step in getting out of severe withdrawal. Allowing two friends to visit every day would be appropriate if the client is successful with calling his mother once a day. Insufficient information is presented in the scenario to indicate that excessive sleep is a problem. The mother of a client with chronic undifferentiated schizophrenia calls the visiting nurse in the outpatient clinic to report that her daughter has not answered the phone in 10 days. She was doing so well for months. I don't know what's wrong. I'm worried. Which of the following responses by the nurse is most appropriate? 1. Maybe she's just mad at you. Did you have an argument? 2. She may have stopped taking her medications. I'll check on her. 3. Don't worry about this. It happens sometimes. 4. Go over to her apartment and see what's going on. The correct answer is 2. Non-compliance with medications is common in the client with CUS. The nurse has the responsibility to assess this situation, asking the mother if they've argued or if the client is mad at the mother, or telling the mother to go over to the apartment and see what's going on places the blame and responsibility on the mother and therefore is inappropriate. Telling the mother not to worry ignores the seriousness of the client's symptoms. A client admitted with a diagnosis of schizoaffective disorder, manic phase, who is currently taking fluoxetine, valproic acid, and olanzapine prescribed has had an increase in manic symptoms in the past week. The psychiatrist prescribes a valproic acid blood level to be drawn at once. The nurse understands the rationale for this prescription, as which of the following? 1. All clients taking valproic acid need periodic valproic acid levels drawn. 2. Fluoxetine can decrease the effectiveness of the valproic acid. 3. A decrease in the level of valproic acid could explain the increase in manic symptoms. 4. The valproic acid level is needed before a short course of lorazepam for agitation can be prescribed. The correct answer is 3. Valproic acid is commonly used to treat manic symptoms. Therefore, a decrease in the valproic acid level could explain the increase in manic symptoms. Periodic determinations of the valproic acid level are necessary to determine the effectiveness of the drug. However, the stat nature of the specimen to be drawn indicates an immediate problem. Fluoxetine is not known to decrease the effectiveness of valproic acid. The valproic acid level is not needed before beginning a short course of therapy with lorazepam. A successful real estate agent brought to the clinic after being arrested for harassing and stalking his ex-wife denies any other symptoms or problems except anger about being arrested. The ex-wife reports to the police, "He is fine except for this irrational belief that we will remarry." When collaborating with a healthcare provider about a plan of care, which of the following will be most effective for the client at this time? 1. A prescription for olanzapine 10 milligrams daily. 2. A joint session with the client and his ex-wife. 3. A prescription for fluoxetine 20 milligrams every morning. 4. Referral to an outpatient therapist. The correct answer is 4. Follow-up counseling is appropriate because of the client's anger and inappropriate behaviors. The goal is to help the client deal with the end of his marriage. A joint session might have been useful before the divorce and arrest, but not after. The client is exhibiting no signs or symptoms of schizophrenia or psychosis, so olanzapine is not indicated. The client is not exhibiting signs of depression, so fluoxetine is not indicated. The nurse is planning care for a group of clients who are chronically mentally ill. Which of the following strategies is likely to be the least beneficial for the client population? 1. Teaching independent living skills. 2. Assisting clients with living arrangements. 3. Helping clients in insight-oriented therapy. 4. Linking clients with community resources. The correct answer is 3. Insight-oriented therapy is less beneficial for this client population. The nurse's role in a psychosocial rehabilitation program involves teaching the client to live independently by using interpersonal skills and community resources. A nurse is teaching the families of clients with chronic mental illnesses about causes of relapse and rehospitalization. What should the nurse include as the primary cause? 1. Loss of family support. 2. Non-compliance with medications. 3. Sudden changes in medications. 4. Non-attendance at treatment programs. The correct answer is 2. Non-compliance with medications is documented as the primary cause of relapse. Although loss of family support, sudden changes in medications, and non-attendance at treatment programs may contribute to relapse, these factors are not as significant as medication non-compliance as causes of relapse. A 25-year-old client diagnosed with chronic schizophrenia states, "I stopped my medications a week ago. I was just tired of not being able to drink with my friends. Besides, I feel fine without them." Which of the following responses by the nurse is most appropriate? 1. It's important for you to go back on your medicines. 2. I hear how difficult it must be to live with the changes caused by your illness. 3. You will have to talk to your doctor about stopping your medications. 4. Your buddies will understand that you can't drink anymore. The correct answer is 2. By acknowledging the difficulties of living with the illness, the nurse conveys empathy for the client's feelings and opens up the lines of communication. Although it is important for the client to maintain compliance with medication therapy, telling the client that it is important to start taking them again or to talk with the doctor about stopping the medications ignores the underlying feelings of the client's initial statements. Stating that the client's buddies will understand may or may not be true. Additionally, this statement ignores the underlying feelings. Which of the following clients has the least priority for admission to a psychiatric healthcare facility? A client with a 1. Potential for self-injury. 2. Potential for injury to others. 3. Grave disability. 4. Decline in functioning at work. The correct answer is 4. Although all of the options are commonly true, the primary reason for concern is that parents commonly provide financial support and housing for their chronically mentally ill children. The most critical needs after loss of the parents are the lack of financial support and housing, which are hard to replace. When developing a community-based service program for clients with chronic mental illnesses, which of the following is the least important? 1. Partial programs. 2. Psychiatric home care. 3. Residential services. 4. Long-term hospitals. The correct answer is 4. For a community-based program, the need for long-term hospitalization is least needed if the other services, such as partial programs, psychiatric home care, and residential services, are available and accessible. The nurse has assisted the physician at the bedside with insertion of a left subclavian, triple lumen catheter in a client admitted with lung cancer. Suddenly, the client becomes restless and tachypneic. The nurse should 1. Assess breath sounds. 2. Remove the catheter. 3. Insert a peripheral IV. 4. Reposition the client. The correct answer is 1. The nurse should first assess for bilateral breath sounds since a complication of central line insertion is a pneumothorax, which would cause an increase in respiratory rate and drop in oxygen, causing irritability. The nurse should also assess blood pressure and heart rate for the complication of bleeding. A chest X-ray will be performed to determine correct placement and complications. A central line was most likely placed because peripheral IV access was not available or adequate for the client. Repositioning may be considered after assessments are done. The nurse in the perioperative area is preparing a client for surgery and notices that the client looks sad. The client says, "I'm scared of having cancer. It's so horrible and I brought it on myself. I should have quit smoking years ago." What would be the nurse's best response to the client? 1. It's okay to be scared. What is it about cancer that you're afraid of? 2. It's normal to be scared. I would be 2. We'll help you through it. 3. Don't be so hard on yourself. You don't know if your smoking caused a cancer. 4. Do you feel guilty because you smoked? The correct answer is 1. Acknowledging the basic feeling the client expresses fear and asking an open-ended question allows the client to explain any fears. The other options dismiss the client's feelings and may give false reassurance or label the client's feelings. The client should be encouraged to explore feelings about a cancer diagnosis. Which of the following areas is a priority to evaluate when completing discharge planning for a client who has had a lobectomy for treatment of lung cancer? 1. The support available to assist the client at home. 2. The distance the client lives from a hospital. 3. The client's ability to do home blood pressure monitoring. 4. The client's knowledge of the causes of lung cancer. The correct answer is 1. Because clients are discharged as soon as possible from the hospital, it is essential to evaluate the support they have to assist them with self-care at home. The distance the client lives from the hospital is not a critical factor in discharge planning. There are no data indicating that home blood pressure monitoring is needed. Knowledge of the causes of lung cancer, although important, is not the most essential area to evaluate given the client's postoperative status. After a thoracotomy, the nurse instructs the client to perform deep breathing exercises. Which of the following is an expected outcome of these exercises? 1. Deep breathing elevates the diaphragm, which enlarges the thorax and increases the lung surface available for gas exchange. 2. Deep breathing increases blood flow to the lungs to allow them to recover from a trauma of surgery. 3. Deep breathing controls the rate of air flow to the remaining lobe so that it will not become hyperinflated. 4. Deep breathing expands the alveoli and increases the lung surface available for ventilation. The correct answer is 4. Deep breathing helps prevent microatelectasis and pneumonitis, and also helps force air and fluid out of pleural space into the chest tubes. More than half of the ventilatory process is accomplished by the rise and fall of the diaphragm. The diaphragm is the major muscle of respiration. Deep breathing causes it to descend, not elevate, thereby increasing the ventilating surface. Deep breathing increases blood flow to the lungs. However, the primary reason for deep breathing is to expand alveoli and prevent atelectasis. The remaining lobe naturally hyperinflates to fill the space created by the resected lobe. This is an expected phenomenon. While assessing a thoracotomy incisional area from which a chest tube exits, the nurse feels a crackling sensation under the fingertips along the entire incision. Which of the following should be the nurse's first action? 1. Lower the head of the bed and call the physician. 2. Prepare an aspiration tray. 3. Mark the area with a skin pencil at the outer periphery of the crackling. 4. Turn off the suction of the chest drainage system. The correct answer is 3. This crackling sensation is subcutaneous emphysema. Subcutaneous emphysema is not an unusual finding and is not dangerous if confined, and the nurse should mark the area to detect if the area is expanding. Progression can be serious, especially if the neck is involved. A tracheotomy may be needed at that point. If emphysema progresses noticeably in 1 hour, the physician should be notified. Lowering the head of the bed will not arrest the progress or provide any further information. A tracheotomy tray would be useful if subcutaneous emphysema progresses to the neck. Subcutaneous emphysema may progress if the chest drainage system does not adequately remove air and fluid. Therefore, the system should not be turned off.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.